What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Welcome to a series of anatomy of the abdomen, and today we're going to discuss the surface anatomy of the abdomen. What's an abdomen? Well, an abdomen is a region of the body of the anterior trunk between the thoracic diaphragm and the pelvic brim. This region over here is what is called abdominal region. Then the abdomen is the cavity that houses the vital organs for the digestive system, urinary system. Remember, you have kidneys and ureters. You have endocrine glands, for example, the adrenal glands that are all found within the abdomen. We have exocrine glands. Remember, also pancreas can be endocrine or exocrine. Don't worry about it. You have a separate discussion about that one. And then we have organs for circulation. We have the abdominal aorta. We have the inferior vena cava, but also we have at times the parts of the reproductive system also found within the abdomen at times. For example, uterus can expand to the abdomen during pregnancy. So and sometimes found within the abdomen. So what's the Bony framework of the abdomen? Bony landmark. So the major bony landmark of the bony framework of the abdomen is formed by the lumbar vertebra. We have a separate discussion talking about the lumbar vertebra, lumbar spine. But this is forming part of the bony framework of the abdomen. But we have the costal margin. This is the costal margin. We have the xiphoid process and the costal margin on this side. We haven't discussed about the pelvic bones, but don't worry about it. We're going to discuss them in detail. It's a separate section that's got maybe a long discussion on itself. But we have this part over here. This something like a line. This one is called the iliac crest. This is the iliac crest. Anterior to iliac crest, we have a projection here, which is called anterior superior iliac spine. Anterior superior iliac spine, which sometimes is abbreviated as ASIS. Don't worry about it. You're going to discuss them in detail and do anatomy of the pelvis. Next, we have so we have the right pelvic bone and the left pelvic bones. They're usually united here by the pubic symphysis or symphysis pubis. Pubic symphysis or symphysis pubis. And lateral to the pubic symphysis, you have the tubercles elevations, which are called the pubic tubercles on either side. And then on the other side also have a line here. This line is called the pecten line or pecten pubis, which is also called pectineal line or pecten pubis here. These are the major bony framework that we're going to encounter today. Now let's see the abdomen, the surface anatomy of the abdomen. And this is the masculine abdomen. This is the feminine abdomen. What about this? This is a fatty abdomen, okay? So for convenience, for the purpose of discussion today, we're going to use this masculine abdomen so as to be able to see a lot of features. We have this bell button here. The bell button in English is called navel, but in anatomical language or medical language is called umbilicus or umbilicus, whichever. So this is the umbilicus or the navel or the bell button. And when you're taking a look on this masculine abdomen, you will see we have partitions, and these partitions people refer to 6 packs. Okay, we're going to learn later that this is the muscle which is called the rectus abdominis. This is a muscle which is called the rectus abdominis, but has got partitions which gives this impression of 6 packs. This 6-pack appearance or appearance. This is called the rectus abdominis muscle. So it's been partitioned, and the part of this partition is formed by the linea alba. This linea alba, the lining extending all the way from the xiphoid process and to the umbilicus, and it also goes to the pubic symphysis, but it's mainly visible above the umbilicus. Below the umbilicus, it's a little bit hard for you to be able to see this line, linea alba. It is translated to the linea alba means alba means white, linea means line. So this is the white line. You're not seeing the white line here, but when you do anatomy of this muscle, you see that white line. But as part of partitions, also it's been made by the tendinous intersection. So you have tendinous intersection together with the linea alba. They are dividing this rectus abdominis and gives this 6 packs pattern. Lateral to the rectus abdominis muscle, you have another line, a line, because it's linear line, but this line is called the linea semilunaris because it's half a moon. So it's a half a moon line, linea semilunaris. But again, we have the superficial epigastric vessels can be seen. We're going to see later. These are superficial epigastric vessels. Yeah, but the umbilicus, this is very important to note that the umbilicus is at the level of L3, L4 lumbar vertebra. This is at the level of 3 and 4 lumbar vertebra. Very, very important to note. So these are superficial veins of the abdomen, and the superficial veins of the abdomen, they are not supposed to be visible to the skin. They are not supposed to be visible to the skin. Forget about the inferior superficial epigastric vessels; they can be visible, but the vessels around this region are not supposed to be seen on the skin. So what happens when they are visible like this? So they become dilated. These are called the dilated superficial veins. The dilated superficial veins around the umbilicus, it is very unique, and it's got a special name which is called the caput medusa. Caput medusa, these dilated veins, okay, around the they are called periumbilical dilated veins, caput medusa. But I told you the other time that anatomy is easy when you link into the Latin origin, because in Latin this caput means head, medusa is medusa, so it is a head of Medusa. But the biggest question is, who is this Medusa they are talking about? Let me show you Medusa. Yeah, in Greek mythology, Medusa, or this guy whose hair was replaced by snakes. He has snakes on his head instead of hair, and this is the head of Medusa. Now, if you translate into Latin, it's caput medusa, but in English, the head of Medusa. But why are these periumbilical veins are linked to the head of Medusa? Because you have the umbilicus here is representing the head of Medusa, but you have the veins that are fanning from the umbilicus, giving this snake-like appearance. And this is why these dilated superficial veins of the abdomen and the periumbilical veins are called the caput medusa. Oh, how could I forget? Yeah, there is something called the Sister Mary Joseph nodes. Sister Mary Joseph nodes. We have sometimes there are lymph nodes around this region which can be enlarged, and that is also pathognomonic. It's like a classic presentation of gastric malignancy. Remember the other time we saw the vitreous node on the left supraclavicular, the left supraclavicular node, but we also have the Sister Mary Joseph nodes which are around the umbilicus. This is very, very important. You should write it down. I forgot to put the picture of it here. The Sister Mary Joseph nodes are very pathognomic of gastric malignancy. Like you find the patient has got the lymph nodes around the periumbilical region. That's called the Sister Mary Joseph nodes, and is classic presentation of gastric malignancy. Okay, so this is the gravid abdomen. Gravid means pregnant. This is how the pregnant abdomen looks like. And the pregnant abdomen is marked by the linea nigra. Linea means lining. Nigra means black. Yeah, so niga. No, those American moves. Niga. So blacks. This is black line. This dark line over here is called linea nigra. Linea nigra is present in 70 to 90% of pregnancies. Like, not all pregnancies will have the linea nigra, but 70 to 90% of pregnancies will have linea nigra, this black line here, which is running all the way from the xiphoid process to the pecten, to the pubic tubercle. Okay, but not everyone with linea nigra is pregnant. Okay, so be careful. But we're not going to dive into details about how these lines are formed. But this is deposition of the melanin, super deposition of melanin, and it happens more likely to happen in pregnancy because of increased hormones. Yeah, but again, another important thing in a gravid abdomen is the presence of these stretch marks. These stretch marks in pregnancy, they are called the stria gravidarum. The stria gravidarum are these stretch marks that are present in a pregnancy, and they are not limited to the abdomen. They can happen to the thigh, to the buttocks. But again, this is not the classic presentation of pregnancy, because even someone who is not pregnant can have these stretch marks, which are called the stria gravidarum. Next, let's see the quadrants of the abdomen. Now, the abdomen is divided into 4 equal quadrants. The word quad means 4, so quadrants, and it's been divided so by the 2 lines. The first line is vertical, and the midline line, which is passing all the way from the xiphoid process to the umbilicus to the pubic tubercle. pubic symphysis, this vertical line. And then the horizontal line is the umbilical lines passing through the umbilicus, transverse line through the umbilicus, and dividing the abdomen into 4 equal quadrants in such a way that you have the right upper quadrant, you have the right lower quadrant, you have the left upper quadrant, and the left lower quadrant. Why do we need to partition the abdomen in this fashion? Because the abdomen is very huge, and at times the patient comes with the issue of abdominal pain. But you want to know, you want to have at least in your mind, like, okay, what might be wrong with this patient? So if you have precise location of this pain, you'll be able to figure out. For example, if he's coming complaining of right upper quadrant pain, what are the structures, what are the organs which are found in the right upper quadrant pain? So you have your gallbladder, for example, you have your liver, you have this part. Okay, so you are starting loading out the diagnosis depending on the regions of the abdomen. But to make it even very precise, it's further subdivided into 9 regions. It is subdivided into 9 regions to be very, very specific on these regions. Yeah, so these are the 9 regions of the abdomen. They'll be divided so by 2 vertical lines. These 2 vertical lines, they are mid-clavicular lines. They're passing through the midpoint of the clavicle, and they're going to transect this inguinal region into 2 points. So mid-clavicular to the mid-inguinal line on either side. And then what are the vertical lines? What are the horizontal line? We have the line through the lower part of the costal margin. It's called the subcostal line or subcostal plane. And then we have the line through the tubercle of the iliac tubercle, and it's called the transtubercular plane. Yeah, so these are the these are the regions of the abdomen. And one more time, these are the regions of the abdomen. So what are they? At the center, we have the umbilical region or umbilical region here at the center. Above umbilicus, we have the epigastrium. Gastrium means stomach. So this region is mainly occupied by the stomach. We have the hypogastrium. Because of epigastrium, we also have a hypogastrium. Okay. On either side of the umbilical region, you have the lumbar region. Okay, lumbar. And then on either side of the epigastrium, we have hypochondrium, which means we have the right hypochondrium region or right hypochondrial region, and the left hypochondrium or left hypochondrial region. Same applies on either side of the hypogastrium. We have the iliac region or iliac fossa, which means we have the right iliac fossa and left iliac fossa. So the job here is to know the organs which are found in these regions. So these are the regions, and we're going to start with the this hypochondrium region. The right hypochondrium is markedly known. I mean, don't try to memorize all this at once. You are going to understand them slowly as we are doing the viscera of the abdomen. We are going to discuss the liver separately. At times we're going to discuss about the pancreas. We're going to discuss about the stomach, and so you be understanding slowly. Do not attempt to memorize all at once. But I will tell you, these are typical. This one you should know. For example, the right hypochondrial region is very, very important to notice the presence of the gallbladder. So the gallbladder and the right lobe of the liver are present on the right hypochondrium region. And this is very important. This you should know from this point. Okay? But later we're going to see also have the the superior part of the kidney is found here, and also a part of this the colon. Don't worry about this colon. We're going to understand them more when you're doing anatomy of the abdomen. Viscera. Then what's found on the epigastric region? Epigastric, I told you gastric means stomach. So the bigger part of the stomach is found in this epigastric region. Okay, we're going to discuss it later, but the pylorus is found within this region. And so the patient comes complaining of epigastric pain. What comes to your mind first is something related to the stomach. For example, the peptic ulcer disease. It should come in your mind first, because this region is where you have the stomach. Okay. And next also we have a pancreas somewhere here, and the left lobe of the liver, because we've said the right lobe of the liver is found in this region. Okay, next we have the left hypochondriac region. What you should remember at this point on the left hypochondriac region is the presence of the spleen. Spleen is found in the left hypochondriac region, but again also the superior part of the left kidney and this part of the colon. Don't worry about them, we're going to discuss them in details. Next we have the lumbar region, the right lumbar region, and what you should remember on the lumbar regions is that you have kidneys. At least the lower parts of the kidneys are found on either lumbar, but we have the ascending colon on the right side and the descending colon on the left side. Don't worry, again we're going to discuss them in details. Okay, what about yes, I've told you this is like a mirror image of this one, except this is ascending, this is descending colon. Don't worry. And then umbilical region, what do we have? Umbilical region, we have the transverse colon and the abdominal aorta and the inferior major vessels. The major vessels of the abdomen, they are found in the umbilical region. Okay, this is what you should remember, at least if you don't have, if you find it difficult to remember these parts. On the right iliac fossa, what you should remember, this appendix. I mean, we have a lot of structures here, but appendix is you should not forget about appendix. And so the patient comes complaining of the right iliac pain. Right iliac pain. What comes in your mind first is appendix. Of course, we also have terminal ileum and cecum, but remember the appendix. On the left iliac fossa, nothing much, sigmoid, coronary. You're going to understand them in details when I'm doing anatomy of the viscera inside. At the hypogastric region here, you can have the urinary bladder, but only when distended. But urinary bladder is found under the pelvis, but when distended, it comes to the abdomen. So it can be, palpated under hypogastric region. Yeah, so there is something very important I want to share with you. Why do we need to partition the abdomen in this fashion? Is because we have said at times you want to describe the pain of the abdomen. And so if someone tells you, okay, I have epigastric pain, you know what are the structures which are found in the epigastric region. And someone is complaining of right lumbar pain, you know, have kidneys, you have these structures which are found here. And pain of the abdominal viscera are usually referred to the skin. You have a pain inside, that pain is not felt within those structures. That pain is, referred to the skin around that region, and that is called the referred pain. We're going to discuss at times about this referred pain, and I think we've already discussed when we were doing anatomy of the shoulder region. I told you the diaphragm, sometimes pericarditis, inflammation of the diaphragm can result into referred pain around the shoulder region because they are sharing the same nerve roots. So those cutaneous nerves, those sensory nerves, they share the same roots with the different nerves that are supplying these structures, and this is why we have referred pain. We're going to discuss it at sometimes, the referred pain, but this is very, very important. Again, this is summary showing you the structures are found in different 9 regions of the abdomen, and this is very, very important to remember. So what are the dermatomes? Dermatomes we also discussed the other time. We said the dermatomes are the regions of the skin which are supplied by a specific nerve root. For example, T10 here, T10, this skin around here is specifically supplied by the T10 spinal segment, not vertebral level, spinal segment. Yeah, there. And we said these nerves are coming on the other side. I told you the other time, spinal nerves, all spinal nerves are mixed nerves. All spinal nerves are mixed nerve, means they have motor fibers and sensory fibers. So the sensory fibers are supplying the skin around those region, okay? So this skin around here is supplied by T10 spinal nerve. Okay, T10 spinal nerve. But we have 2 nerves, one on the right, one on the left. This nerve, they do not cross midline. So the right one is supplying the right and the left supplying the left. And what is most important about this clinical anatomy is the presence of shingles. We discussed the other time herpes zoster. Sometimes we have inflammation, we have the virus which is infecting the nerve root, in the spinal cord, and this will result into shingles-like appearance in the dermatome, which is supplied by that specific nerve and creates the belt-like appearance. And this is what in Swahili people call the mkanda wa jeshi or the belt, because it supplies specific region, a belt-like region or a skin of the body, and this is what we call the dermatomes. What should you remember in this presentation, these dermatomes, is at least, if you want to forget, please remember the T10, the umbilicus is supplied by T10. Skin around the umbilicus is supplied by T10, and the skin around the nipple is supplied by T4 nipple, T10 the umbilicus. Discuss about the McBurney point. What's the McBurney point? This is the point that marks the common location of the appendix. This is the common location of appendix. How is it determined? You draw a line between the umbilicus and the anterior superior iliac spine. Anterior superior iliac spine and the umbilicus, and then at the junction between the two medial third and the one lateral third is where the McBurney point is. Why is it so important? Because this is the common location of the appendix, and if they want to chop out the appendix, they will consider this location here. They want to do the surgery, around this region so as to chop the appendix, because this is the common location of the appendix. How is it determined again? You draw a line between the umbilicus and the anterior superior spine, and then at the junction between two medial third and one lateral third is where you have the McBurney point, and this is the commonest location of the umbilicus. Yeah, so this sounds like pretty much it from this discussion. If you have a question, additional comment, you can always put your thoughts in the comment section, and see you into the next discussion. We're going to discuss the anterior abdominal wall, the wall of the anterior abdomen. Okay, see you.